So we're just ready to welcome everyone to our Lunch and Learn webinar featuring Brandy Rimhall. I'm Mary Barrett, their Alumni Program Manager here at UWS, and we're really excited to be offering this Intro to Healthcare Credentialing. Brandy has also agreed to be able to answer questions for UWS for the forward part of the next year, which we're very excited about, and we'll talk a little bit more about at the end. Among her qualifications, Brandy is a certified professional coder, medical compliance officer, and medical auditor. And we'll be hopping into this introduction to healthcare credentialing. Feel free to put questions in the chat as we go, and Brandy can answer them as we get going. And then also toward the end, we'll have a Q&A. So with that, I'm going to hand this off. Thank you so much for being here.
Thank you so much for having me, and everyone who's joined us today. Thank you also for taking the time out of your day to discuss credentialing with me. Just to give a quick introduction to myself, this is my 25th year in chiropractic and multi-specialty, and really I have had nothing but fun for the past 25 years in everything to do with the revenue cycle processes, the coding, the billing, credentialing, all of those areas that most docs just simply don't enjoy. It's been an area that I have just thoroughly loved for all of this time. And so as we move forward today, we're really isolating of my many favorite topics down to one, which is related to the healthcare credentialing and enrollment processes. And what I have found, so Rapid Credentialing, I'm here representing Rapid Credentialing today. Rapid Credentialing is my company, and one of the things that I have found as it relates to really everything to do with the revenue cycle system is that there's an awful lot of uncertainty related to all of it. So as we go through today, whether you're a new doc, a student, or an established doc that's maybe trying to figure out what to do or growing in your business and adding providers, we definitely have some information that's going to be useful. That's probably going to answer some of the questions that you have perhaps been wondering for a while. With that being said, again, if you have any questions, do pop them into the chat box because I'll do my best to answer them before we conclude today. And I'll give you my contact information to reach out to me as well for if we don't get to any questions or you think of something after we close. So as we get started, I really kind of want to lay this, the beginning of our topic out today is sort of we're pouring the foundation for our business. And so once again, whether you're new, established, just making changes, moving to a new location, whatever that may be, really in practice, we have three big bubbles of things that we want to focus on or need to focus on in order for the business to be successful, compliant, and really producing what it's capable and what we expect it to produce. Certainly one component of that is going to be our patient visits and patient care, which we're not going to discuss any of that today. The other two components relate to the revenue cycle system and rules and regulations. So as it relates to credentialing and enrollment, there are elements of that in both of those bubbles. And so the regulations and rules, as well as the revenue cycle system. So we're going to really just dig into that today to help you pour the foundation. So it's really like if you're building a house or any kind of structure, you want to make sure you're building it on a solid foundation. And certainly the credentialing and enrollment part, as it relates to the rules and the revenue cycle system, is part of that business foundation that we want to make sure is stable and solid for us to build upon. So I'm going to start by answering this credentialing and enrollment type of questions so that you understand the process at work with a third-party payer to allow you to submit the claims and have your claims processed according to your network status, out of network or in network. So the credential be accepted to submit claims for them. They want to make sure that they're minimizing risk of fraud and abuse. And so there's a component of this to compliance as well, which I know we have all heard about in the past. And really the goal is to help protect the third-party payers from fraud and abuse. And so the credentialing piece, really to put it in a more abbreviated summary, this is where they verify that you are located where you say you're located, that you have the proper malpractice coverage, that you are who you say you are, that you don't have any major red flags, perhaps audits or different things like that that had taken place that would warrant them to look a little more closely into whether or not they're going to allow you as a submitter to the third-party payer or network. Moving forward into the enrollment process, what happens after credentialing is the enrollment. And this enrollment process is what you go through if you're enrolling as an in-network provider. So I want to kind of establish a unique difference between in and out of network. So as an out-of-network provider, many payers are going to require you to go through the credentialing process because they're still being expected to accept and process claims for you or from you as an out-of-network provider, meaning they're still going to be responsible for determining coverage and benefits and reimbursing either you or your patient, depending upon how the billing is being done as an out-of-network provider. So credentialing is often still required under many of those payers and networks for out-of-network providers. With that being said, once you complete credentialing, if your intent is to be an in-network contracted provider, you would then be going through the enrollment process. And really what the enrollment process does is it helps to establish a contracted relationship between you and a third-party payer and network. This enables you to access the patient's in-network benefits for covered services. And it outlines also for you in the contract that would be shared with you, your own network obligations as it relates to that payer. Those network obligations are things like the requirements for submission, any other requirements that may be involved, such as requirements for pre-authorization, requirements for referrals, requirements for different documents that may be required by that network or payer, such as medical necessity review forms, patient summary forms, and other payer or network specific documents that are required in order for you to access that coverage. With that being said, not all payers have all of those extra requirements or documents, but some do. And this is something that you would learn as you go through that enrollment process, and you get your contract that tells you what's expected of you as a network provider. Moving forward, a little bit more on the process of the credentialing and enrollment. And again, these are two separate processes that really go hand in hand. Credentialing comes before enrollment. If you're enrolling or registering as an out-of-network provider, the process is really going to stop for you after the credentialing process is completed and you're approved after credentialing. At the same time, again, if you're enrolling as in-network, the credentialing department at the payer or network is going to pass the baton to the enrollments department, in which they're going to go through their process. Now, these processes, again, one comes right after the next, and I was going to just quickly summarize for you what takes place throughout those. And so in order to credential and enroll with a third-party payer, the first step you're going to do is complete an application. Now, these are payer network specific, which means in order to complete the applications, you may find that these are done online. Many of them are still done manually in forms or PDFs that are submitted over. And sometimes even phone calls have to be made to go through and begin the credentialing and enrollment process directly with the credentialing department of the third-party payer or network. The summary of the application process is that this is very payer specific and they all have their own rules. And so it's not one of those things that you can just submit a bunch of applications all in one and everything happens at the same time. So definitely important to make sure that the application process is followed properly, because once the baton is passed on to the payer, in other words, or the network where you're going through credentialing, it really becomes under their entire umbrella, and anything can cause the applications to be kicked out, to be delayed, to hit a snag of some sort. So there's a lot of communication that needs to take place in order to see these across the finish line. And I will explain more of that to you as we move a little bit forward. But moving on into the process, the next step is really the verification. And this is really related more to the credentialing side of the process than it is the enrollment. And this is again where they confirmed all of the information that malpractice coverage is current and active, that you're located and treating where you say you're located and treating, all of the screening related data that they would be requiring of you in order to begin to determine that you're a credible provider and that you've met the qualifications and standards that would be required for them to accept claims from you, again, either as an out-of-network or an in-network provider. So once that verification process is completed, it really goes then into review. And this is where the payer or the network reviews your application and all of the supporting data. So you have to often upload or send over multiple supporting documents, copies of malpractice, lots of different things like that for them to review and to file for you. Again, like I mentioned, under the credentialing side of things, this is where they review for your qualifications and standards. But once that's passed over into the enrollment side, if your enrolling is in network, the review process is really going to review your provider type, your specialty, what is allowed and required at that particular time in order to approve you for network participation. And that is the process that goes through. And then finally, the last step is the approval. And this is really the confirmation of your qualifications and standards. If you're requesting an in-network enrollment, your application and data progresses to the enrollments department for processing. They have what they call contract loading, and that is where your contract is being put together, your effective date is being established, and other details related to that are just about to be issued to you, which, by the way, is often issued either by standard mail or by email, and oftentimes even just simple notification in the portals that confirms with you that you are in the network. If you're requesting an out-of-network registration, once the credentialing process is completed, you do typically receive confirmation of that, and your claims are going to begin to be accepted and processed out of network. So if you're already in practice right now and you are submitting claims electronically and you have a bunch of funny looking rejections in your clearinghouse that say this provider isn't allowed to submit claims to this network, it's likely because that particular payer or network requires out-of-network registration, and you need to go through that credentialing process to do that before your claims would be accepted. At the same time, if you're submitting paper claims, those may come back denied for the same reason, saying that you're not eligible to submit to that payer. And there again, that's most likely telling you that there's a credentialing process that needs to take place before you're able to access the coverage and benefits under your patient's plan. The next thing moving forward with credentialing and enrollment, that's a very common question that comes across my office, is really how long does it take? And the short answer is every single payer and network is different. However, the common answer that every single one of them will give to you is to allow about 120 to 180 days for new enrollments. And if you're making changes to an enrollment, so for example, if you've moved from this address to another address down the street or in a different town in the same state, then it takes less time because you're already enrolled. You're just making updates and changes. That takes about 60 to 90 days on average to go through to approval. So those are kind of just benchmarks to look at. Really, the summary of this is once you know that there's going to be a change made or you're needing to be enrolled with a third-party payer or a network, the best thing that you can do for yourself is to just simply be proactive and getting started with those enrollments. We do get a lot of phone calls in our office for clinics that have added providers last month or next week and those types of things with the expectation that the enrollments are going to be immediate. And that is really not ever the case. And so we, if we have an enrollment come through, a new enrollment come through in less than 120 days, we are ecstatic here because the process simply is not a quick process, really under any circumstances. And like I mentioned earlier, really there's anything that, there's so many different things that can hold up an enrollment or an application or can cause it to be rejected and kicked out. With that being said, I always like to focus on the things that we can control and the things that we can't control. And I meet with my team on this all the time because What we can control is ensuring that the applications are completed properly, that all of the required documentation is prepared, gathered together, organized, and submitted together so it can be really handed over to that payer or network for proper processing. Even when all of those things are done perfectly, you never know when they're going to request something else or when there's some kind of question that takes place that perhaps delays it. And those are the things that we often can't control. With that being said, having increased communication with your payers and networks that as you're going through this process is going to really be a lifesaver for you because, time is money, right? And we want to make sure that we're enrolled and allowed to submit claims as quickly as we can because this affects a lot of things, not just our cash flow, but it affects how we're verifying benefits and what benefits we're verifying, if we're billing and how we're billing, how we communicate to our patients and what we communicate to our patients, how we collect and what we collect from our patients. There's so many things that are attached to this. And so increased communication is incredibly important. Anything related to the revenue cycle system in general. However, most certainly in the credentialing, right at that foundation level too, like we're talking about today, definitely important to make sure that you're communicating and reaching out to check the status of applications, or if you're working with a credentialing service, making sure that they're doing that. Another common question I have coming in that is always good to touch on is in-network versus out-of-network. And this again is one of those topics that we often as providers don't know what's going to be the best for us or which networks are going to be the most beneficial to us. And so on this particular slide, I wanted just to take a couple of minutes to maybe help you make some of those decisions that you may be stumbling on. So here are some, really things you need to know and some benefits perhaps even to the in-network and out-of-network situations so you can decide what's best for you. In my own personal perspective, there isn't a wrong answer because the right one is different for every provider in every different situation. They just really need to process through all of the details related to each. So getting started with the in-network, a couple of things you need to know is, of course, as an in-network provider, you do have a contract with the payer in the network, which is going to outline your obligations as an in-network provider. These obligations include details for claim submission, which is typically telling you you're required to submit clean claims in a timely manner on behalf of the patient. You're accepting the allowed fee schedule that is allowed under your network contract. Any other obligations that would be required, such as pre-authorization, medical necessity review forms, things along those lines would also be outlined for you in this agreement. This also allows you as an in-network provider to be listed on a payer network directory. And if you haven't ever looked at those, kind of the unique thing about them is that this is often a resource for patients to go to for any type of insurance they may have, where they can find a list of providers that are in their network. And there's an advantage to the patients to going into to see an in-network provider, and I'll explain that in a moment. But ultimately, the in-network benefits to the provider, the payers and networks will say they're essentially doing marketing for you to some extent because they are listing you in their provider network directory, letting patients with that type of insurance know that this is a provider that's in the network with their insurance, which as a patient, that means lower deductibles, lower co-insurances, lower co-pays, things along those lines that have a financial benefit and advantage to the patient. Next, you also have access, of course, to the in-network benefits for the covered services that meet your payer criteria. And once again, the in-network benefits, if you've ever verified benefits for in-network and out-of-network under the same plan, you're going to find that those typically are drastically different. So in-network benefits has the lower deductibles, has the lower co-pays, co-insurances, and patient out-of-pocket overall, which there again, like I mentioned, there's an advantage to the patients, but it does help you get reimbursement more quickly from the third-party payers, generally because the deductibles are lower and the patients are going to be meeting those deductibles. As a matter of fact, some out-of-network benefits, the deductibles are so high that the patients go the whole year and don't ever even meet their out-of-network deductible. So there are some advantages to you as the provider and certainly to the patient for you to be able to access those in-network benefits. And then one of the other advantages that I think often goes maybe overlooked slightly is that another advantage to being an in-network provider is the expectation of increased patient volume in your office. So if you've ever looked at fee schedules for in-network and out-of-network under the same plan, you're going to see that the in-network benefits, not always, but most of the time, are slightly lower than the out-of-network reimbursement once reimbursement starts for the same services. And the reason is because as an in-network provider, the payer is essentially doing marketing. You have a contract with the payer and you have the expectation of increased patient volume. So I tell docs all the time, if you're in an area where there's an employer that you'd really like to have more patients coming in from, schools, different types of, employers all over the place, you have the expectation of additional patients coming into you simply by being in those networks, and there's a huge advantage to you for doing that. Moving forward into really understanding how the out-of-network benefits work, you as the provider don't have a contract with the payer or network. With that being said, and it's especially important to keep in mind, the patient in either case has a contract with their insurance company, regardless of whether you, the provider, are in network or out of network. So something that's especially important is to bear in mind that as an out-of-network provider, you're still obligated to collect from the patient their copays, deductibles, co-insurances, those patient responsibilities as it's defined by the payer. So we don't have the right as an out-of-network provider to step in between that patient obligation or that patient agreement, because their contract with the provider or with their network says, I agree to pay whatever deductible, whatever copay, co-insurance, and those types of things. So we can't be in a position where we're causing the patient to be in breach of their agreement, because there are vulnerabilities, significant ones, to providers for doing that. So please make sure that you are following those out-of-network claims and collecting from your patients how those claims are processed according to what the patient responsibility is. But as an out-of-network provider, you do have a little bit more latitude in a couple of other places. One of them is you do have the right, if you'd like to go ahead and still submit claims to access the out-of-network benefits for the covered services that meet the payer criteria, which means you can bill as an out-of-network provider and accept the coverage, the benefits, the reimbursement, all of those different types of things, which most providers do. At the same time, many out-of-network providers say, we don't bill your insurance, we're out of the network. In that event, you may go ahead and offer to your patients that they can self-submit. And in that event, you'd provide to them an itemized statement or a super bill, and they can submit to their own insurance to be reimbursed if there's any coverage at all for them. And you are out of that insurance process altogether as an out-of-network provider. There are a couple of highlights here that I want to point out is Medicare, your state Medicaids, those types of plans are excluded from that last statement. As a healthcare or as a chiropractor, rather, you are obligated to be first enrolled with Medicare as in network or out of network. And you are obligated in either case to submit clean claims in a timely manner on behalf of your patients. And the same, depending upon the state you're in, some states don't have Medicaid plans that cover chiropractic, some do. So learn your state rules as far as that goes, but you would be obligated to submit those claims as well if you're enrolled with the Medicaid and if it's required in your area. So check your rules on that depending upon your state, but certainly for Medicare, you're going to need to be enrolled if you're treating Medicare patients. And then, like I mentioned, as an out-of-network provider, the reimbursement does tend to be slightly higher in most cases for out-of-network. But there again, this is after the patient has met a deductible, the patient's out of pocket, their copays are higher, co-insurance amounts are higher, those types of things. So definitely important to keep that in mind. And really, just again, before we flip into the next slide, I want to just confirm. So for your third-party payers, your commercial payers, if you're enrolling as an in-network provider, you can register as out-of-network, and that's often required. The difference with Medicare is that Medicare requires you go through the credentialing and enrollment process regardless. And so you would, as a chiropractor, be obligated, if you're treating Medicare patients, to enroll either as a participating, which is the same as in-network with Medicare, or non-participating, which is the same as essentially as out of network with Medicare. And once again, you have to enroll and you're obligated to submit claims on behalf of the patient in a timely manner. So we can cover that Medicare umbrella really in a segment all by itself one of these days if we need to, but definitely important to keep in mind that we can't opt out of Medicare or have our patients self-submit. We do have to still bill to Medicare regardless. So here are some in-network versus out-of-network need-to-knows as it relates to the patient side of things, which I think is always helpful for us providers to know as well. Like I mentioned, first, we have the lower deductibles and co-pays and co-insurances under in-network benefits. Coverage tends to be better in general, so the coverage is more limited under out-of-network than it is in-network. And then they have the ease of finding providers because they can simply go to the directories and find someone in their region. Out-of-network information that's helpful for you to know on behalf of your patients is they do tend to have higher deductibles and patient out-of-pocket amounts, like I've mentioned. And there also does tend to be more limitations to coverage, sometimes no coverage at all, if you're an out-of-network provider, which really highlights the necessity of making sure as providers that we are verifying benefits for our patients so that we can make sure to communicate to them what their estimated coverage and benefits are according to our enrollment status. A lot of clinics like to leave that up to the patient to learn their own benefits and limitations of their insurances, which I certainly understand and support that. At the same time, most of the time, patients don't know the questions to ask. And when you call in to verify benefits, the default is always to get in-network benefits. So unless the patient knows specifically to ask for something different, they're likely to be misinformed in many cases because they just, again, don't know the questions to ask. So definitely useful for us to know on behalf of our patients and to communicate to our patients. Which brings me to this next slide here that I want to share with you. And to avoid getting into the weeds too much, I really did want to highlight how coverage works because this is directly related to our credentialing and enrollment, whether we're in network or out of network with a third-party payer. So every single patient has their own set of coverage and benefits as it relates to the plan that they've selected under their insurance. And again, their benefits they're going to have in-network and they're going to have out-of-network benefits. And that is determined by as to what you're accessing as the provider, your particular enrollment status. At the same time, as providers, regardless of whether or not we are in or out of a network, every single payer, so Medicare, Blue Cross, Aetna, Cigna, and the list goes on, have their specific payer guidelines that we're obligated to adhere to regardless of our network status. And so coverage is determined by certainly our enrollment status as a provider, but also, are we meeting the coverage guidelines? And in chiropractic, really that boils down to, are we meeting the medical necessity standards as it's required by that third-party payer? Because remember, the foundation for all coverage in general, regardless of provider enrollment for in-network and out-of-network providers, is that we meet the medical necessity standard of the third-party payer. So extra important that we get to know our payers because we always want to be in the best position to get paid correctly and properly for what we're doing, but also to be able to keep that money once we have been paid, right? And so this is kind of part of that foundation that once again, we could spend an hour just breaking this down into the granular pieces, but as it relates to the credentialing enrollment, definitely important to make sure that we touch on because it matters across the board, regardless of how we're enrolled with insurance companies. So if you are kind of teetering on some of the networks that you may be interested in considering joining, I really do have a little bit of a decision tree here for you to help you walk through what might be the best decision, because again, the right choice isn't necessarily the same for everyone. So a few things that I always tell docs that call my office and are wondering what is the best payer or should I enroll with this network or this payer, these are the few things that I tell them. The first thing is you want to make sure that you get to know your region and the major employers and payers in that region. Certainly you can find that by reaching out to an office like mine because we work in all states and we're in the middle of payers and networks every single day, all the time. So we can answer questions like that and provide some guidance to you. Certainly, your state associations are often fantastic resources for that, peers, other providers, and other individuals, even patients, because they'll often come in and request, or they'll bring insurance cards to you that are definitely worth taking a look at and reaching out to learn those particular payers. You may also want to consider your target markets. And so a couple target markets could be if you live in an area where perhaps there's a lot of Medicare age or retired housing, or people that live there that are in that retirement era. Medicare would be fantastic. Honestly, I think Medicare is a good one under most any circumstance, because we have Medicare patients. And like I mentioned, you have to be enrolled with Medicare as a chiropractor to see Medicare patients, and rather than having to refer them elsewhere, your best choice is going to enroll either as participating or non-participating. Another common target market that comes across my office a lot is the Department of VA. There are veterans associations and different there's the Air Force. I'm in Colorado, so we have the Air Force Academy and different the Air Force Base and different places like that. So there's all kinds of veterans in these areas. And so the Department of VA is always a good target market. And again, there are others. It could be athletes, it could be different types of patients that may have the typical common type of insurance that you'd want to look into. And then also just simply familiarizing with your payers. Again, you can reach out and ask my office, ask other peers, other chiropractors that you know. And the other thing I would definitely suggest you to do is learn of potential payer requirements so that you're not surprised by them once you're already in the network and find that there's rules you didn't know about. In having been in billing and credentialing for the past 25 years, one of the most common ones is that pre-authorization or some other forms are required that the providers didn't know about at the time they completed their network enrollment. And now all of their claims are being denied because they didn't complete the prior authorization requirements, those types of things. I will say, just on that topic, again, having been in billing for a really long time, the best answer for the clinic is always the best answer for that individual clinic. Those types of forms, as long as you're prepared for them, it tends to not be too much of a hassle and very easily manageable as far as implementing that as part of your daily processes. So I would definitely say don't be scared of those types of requirements, but just understand there's another step you're going to need to take and to implement in your clinic. Because you're going to have to, comply with those rules before you're able to access that coverage, right? And keep in mind too, and I tell you because I just get asked all the time, well, what happens if we didn't know there was pre-authorization? Can we go ahead and just bill the patient and then get pre-authorization moving forward? No, you really can't, because who else gets a copy of the EOB besides yourself? The patient does. And on that EOB, it tells on the lower line item, the patient, it says you may be responsible for, or you may be billed, and it says 0. And below that, it says because there was an obligation for the provider to obtain prior authorization or to submit documentation or whatever it is that wasn't completed. So we have to make sure that we're following those rules and, learning of them as we are familiarizing with our payers and making decisions on the networks that we're going to be enrolling in. So the next piece I really have for you here is there are multiple common questions, once again, that come across my office as it relates to credentialing, and some of them are probably questions you're wondering about. So I thought the best next step would be to try and answer those in advance. And once again, certainly if you have questions, go ahead and type them into the chat box, because I'll be more than happy to answer them before we conclude today, or if you reach out afterward. So one of the common questions we get is, well, hey, can I get out of a network once I'm in the network? And the short answer is yes. So what you would have to do is really just simply contact the network and go through their process for unenrolling and being removed from the network. There is a process, documents to fill out and things like that. My office does help a lot of clinics or providers getting out of networks once they're in. With that being said, there are some Medicare rules for this that I wanted, to highlight, but not get into the granular details, because we simply just don't have time to isolate Medicare in too much detail. But there are Medicare rules for changing your enrollment status. So if you're a participating provider and you want to be or vice versa. Medicare only allows this process to happen one time per year, and they actually open this mid-November of every single year, and that process is allowed and open through the end of the year. So mid-November to the end of the year, you can change your enrollment status with Medicare. So you definitely want to be on top of that. And again, my team helps clinics and providers do that all the time, every year from November moving forward through the end of the year. We have those types of applications going on. So you just want to get to know your payers. Certainly reach out to my office if you have questions. The next question I get is, okay, well, once I'm enrolled, are we enrolled forever? Is it one and done? And the short answer is no. So most every enrollment that you're going to be complete, or every network that you're going to be enrolled in, is going to have obligations for you on a periodic basis in order to maintain or monitor those enrollments. And so many of those include your CAQH, that's an enrollment portal, Availity enrollment portals, United Healthcare, state Medicaid portals if you're enrolled there, Medicare, the PCOS portal, and there's others as well, but those are, the most common ones that are out there anyway. And those enrollments have to be maintained and updated, some of them every 90 days, some of them every 120 days. And then again, Medicare and PCOS does have their additional separate rules. For chiropractors, it's 5 years. If you're enrolled with DME, it's every 3 years to do what they call an attestation. So it's just really the attestation and validation period you'd go through. What happens if you don't complete those in a timely manner every 90 days, 120 days, and so forth as it's required? You will be notified first, usually by email, that your verification or attestation is due. If it's not completed, a period of time after the expiration date of that due date for completion, you will be first removed from the directories, and then you're going to be removed from the network, which ultimately means your claims are going to start processing out of network or rejecting altogether, and you will have to start completely over with the enrollment process, which again takes a period of time. So going back to how everything else this impacts, certainly your billing, how you're communicating with payers, how you're communicating with patients, what you're collecting from your patients, all of these different types of things. So critically important to make sure that those are being maintained. One of the things that my team does is maintain and monitor enrollments for our credentialing providers that would like for us to do that. And really that's entails us gathering all of this information from you, and we make sure that those attestations and verifications are completed and submitted in a timely manner so that you don't ever have a snag in any of those enrollments, because it definitely, again, it's a process. If you get kicked out of the network for something willful for any reason, but certainly for not attesting or verifying the enrollments, it is again another 120 or so days before you're going to be allowed and approved back in the network. And that certainly can be very disruptive in a lot of ways, as you might imagine. Another common question I get is, well, how soon should I start credentialing and enrollment? And really this applies, we could be, if you're a new business, it could be, as soon as you have your location, you have your tax ID, all of your information is in place as far as you have your NPI number, malpractice coverage, where you're going to be established, that's going to be the best time and always the most proactive you can be. If you have all of that established and you're going to be getting started in the next 90 to 120 days, right now is the best time to get started with enrollment, because you want at least some of those approvals to be coming through or very close to coming through to approval by the time you get started. If you're an established business and you're adding a new doctor, really the same thing applies. As soon as you have determined that this is the new provider that you're adding, you have an agreement with them to start with employment, collect their information and begin that enrollment process, because there again, if you have someone starting June the 1st and you hire them today, their enrollments aren't going to be through and approved by June the 1st. And so you'll want to start as soon as possible in order to have those through, so you don't have a disruption in your billing and your cash flow and things like that. With that being said, the next question is, well, can they even start seeing patients? And the short answer is maybe they can, depending upon the payers, the networks, and the rules, and you could be doing that. So that would be a conversation to really have in an individual type setting, so we can make sure to communicate to you the Medicare rules, anything that might be state specific or payer specific, and what that really means to you, because definitely important to always follow the rules. That goes again to the statement I made just a few slides past. We always want you to be in the best position to get paid properly for what you're doing and to keep the money that you have been paid. And certainly minimizing vulnerabilities as far as the credentialing and enrollment is a top priority in regards to that. And so again, touching base on this, can I start seeing patients if my enrollment is approved? There are Medicare specific rules. Medicare, it allows us to actually request a retroactive effective date. So if you have a provider starting on June the 1st and you're starting enrollments right now, or even if you're starting enrollments on June the 1st, we can go ahead and request June the 1st as an effect date, and Medicare will approve that. With that being said, most of our other payers don't allow us to request an effective date. We have to go through the credentialing and enrollment process, and they give us the date according to their own processing rules. So it does make a difference by individual payers and by individual states, which is why, once again, that's just a better individual conversation, so we can make sure that everything is exactly as it should be for your office to minimize vulnerability, or eliminate vulnerability rather, and make sure you're in the best position to be productive, profitable, communicate properly with your patients, and so forth. There are billing and compliance rules related to all of this, and so definitely important to keep in mind. And like we've mentioned a few times, again, there's always the downstream impact to everything with our office is our patients, right? And so whether or not our provider is seeing patients, if they're in network, out of network, whatever, if we're holding claims to wait for approval, whatever that situation may be, impacts how we bill, how we collect, how we communicate with our patients. And so we want to make sure that we really have those things just ironed out on an individual basis. So another common question we get is, I'm an enrolled provider with multiple payers, but I've changed employers, I've changed perhaps business locations, or I've moved to a new state. So now what? And this really, if you're enrolled and you're changing a location or an employer in the same state, your credentials and enrollments can be reassigned. And so the unique thing about that is it is an application and approval process, but it goes through more quickly simply because you've already been through the credentialing part of the process with those payers and networks. And my team, again, does those all the time, even for businesses that, we're adding a new location. And so we need to add more enrollments or add this new address, those types of things. They do come through quickly. Once again, as far as how soon to start, the more proactive you can be is always going to be to your advantage. Now, the difference with a state change, if you're moving to a new state, there are a few things that you would need to know about. One of them simply is that the Medicare contractor is probably going to be different from one state to the next, depending upon where you're going. So Medicare enrollments may need to be completely redone depending upon that. Certainly your state Medicaid and also your state Blue Crosses, because those are individual by state, and then any other state plans would be new enrollments. But your other enrollments, such as that are more global, like Aetna, United Healthcare, Optum, those types of networks typically can just be reassigned to a new state and new location there. Once again, every credentialing situation is as many similarities as we all have in our individual practice settings and situations. There are all kinds of differences and variables that many of these pieces are the granular pieces we collect when we meet to discuss credentialing with you, so that we can make sure that we are taking the best action steps moving forward to help you, and certainly keeping you compliant and getting your enrollments through as quickly as possible. The next question I get is, can I do my own credentialing and enrollment? And the short answer is yes, you certainly can. A few things that you would need to know is, again, every single payer and network has their own process and requirements, and even for following up and getting through to approval. So you want to make sure you learn and know those and be proactive in communications with those credentialing and enrollment departments, because that's ultimately what's going to help you be more efficient and successful in getting those approvals through. And it can be very time consuming and daunting. Maintaining the enrollments, like I mentioned a few slides past, for any of your networks and payers, you're most likely required to attest or validate on a periodic basis, and you're going to want to know those rules so that something doesn't slip through the cracks and you end up being, unenrolled from a network and having to start over. The next thing is just really payer network communications. It does really take a lot of communication. I can tell you I have a team of 6 credentialers, and we do follow-ups every single week on applications, some of them even more frequently, simply to know the exact status of them and move them along. If you might imagine a relay race, you're running and you hand the baton from yourself on to the next person in line for the relay. It sort of works like that on the insurance and network side. As far as credentialing goes, there's multiple different people in multiple different departments that are responsible for processing certain aspects of your credentialing and enrollment applications or the documents and details that go with it. As you might imagine, the more hands involved in things, the more chance for oversight, something getting lost, something getting missed, those types of things. And it's really that proactive approach and incredible communication that helps to move those things through as quickly as they possibly can. So it is time consuming. And as we all know, time is money too. So you want your applications to come through quickly. We certainly want to as well. And that's the kind of the part, like I was mentioning earlier, one of the things that we can control is our frequency of communication and making sure that we're moving the applications along as quickly as we possibly can, and knowing the status of them so they can be escalated if they needed to be, those types of things. Anyway, it's important to make sure, because the moment you don't call in for a month or two is the application that they say that they've tried to email you, or it gets lost somewhere and you have to start over. It's incredible the things that happen. And I relate it to billing. I do a lot of billing with insurance, and I speak with billers and billing services all the time. And I tell them, how you submit claims and your clearinghouse says that the claims made it there, but yet nothing ever came back to you, nothing was processed. Who knows what happened? The same thing happens with applications and credentialing and enrollment. So you really do have to keep your fingers on the pulse of it to make sure that those are moving forward as they should. The next question is, if I am enrolling as an in-network provider, am I guaranteed enrollment approval? And for Medicare, yes, Medicare, unless there's a reason from the credentialing side of things for fraud and abuse where they would see that there's risk, then they would, deny the enrollment. But generally speaking, you would be guaranteed under Medicare for enrollment. Other payers at the same time, your commercial payers, they do have what they call network panel guidelines, which includes multiple things. And one of them is limitations on the number of providers of the same specialty in every single region. So it is possible for you to come upon what they say the panel is closed. And what that simply means is we're no longer accepting, at least at this moment, accepting providers of your specialty in the region that you're in this particular network. And so what you do next is make sure that you continue to follow up. My team follows up on closed panels about every 30 days just to see if the panel is reopening or if there's any indication it will be soon, because we want to really be on top of it in the event that happens, so we can reach out to our providers, let them know the network panel is opening, and be ready to push the application through at the time that panel opens. And so you can run into closed panels, and that's for in-network. So what you'd want to do in that event, most likely, is go ahead and register for out-of-network submission and submit as an out-of-network provider if you'd like, until that panel opens and you can complete the network application and the network enrollment process toward approval. So with that being said, that really covers most of the end-to-end as it relates to credentialing and enrollment. I know that was really a lot to take in a short time. Hopefully that answered some of the questions that you have. Once again, if you have any questions at all, please type them into the chat box. I also have on the screen here 2 emails. One just goes to my team, the support or you're welcome to email me directly as well for any questions related to credentialing and enrollment. Or if you have specific situations you'd like to discuss, I'd be more than glad to schedule time for you to do that. And really the sum of it is, credentialing and enrollment is part of really pouring the foundation to your business. And it's one of those things that regardless of how long you've been in business, this is part of that foundation that either continues to need to be poured or continues to need to be maintained depending upon the payers and networks that you're enrolling in. So hopefully this was helpful and resolved at least some of the questions that you might have related to this process. Thank you so much for joining us today. Again, reach out if you have any questions at all. I do quickly, before we conclude, want to just introduce you to Rapid Credentialing. I did mention already that it is my company. I have 6 credentialers. They're all professional credentialers. And this is what we do all day long is communicate with payers, do follow-ups, submit applications, communicate with providers, and then maintain and monitor the existing enrollment to make sure that everything continues to go as seamlessly as possible. As you might imagine, once the credentialing and enrollment is completed, or credentialing part, if you're out of network, this affects your billing too. And so we communicate as well with billers and billing services to help ensure that your claims are established to be routed and billed properly, because that credentialing is what enables you to submit those claims and access either the in or the out of network benefits for the payers and networks that you're enrolled in. So again, if you have any questions, let me know. Otherwise, have a wonderful rest of your day, and thank you for taking your time.
Thank you, Brandy. Thank you, everyone, for joining us.